capital. This is the news at 10, live from Channels Television. Reporting tonight, Amarachi Ubani.
Good evening and welcome. Tonight, the Nigerian Medical Association orders members back to work tomorrow as it suspends a nationwide strike action. Presidency applauds doctors' decision, advises them to show more patriotism in future. INEC opens window for registration of more voters, those who are now 18 years to take advantage. And DR Congo Health Minister confirms Central African country first fresh Ebola virus disease. It's been a long battle between Nigerian doctors and the federal government over welfare issues, including salary raise, and leading to doctors calling out colleagues to a strike action. A battle came to an end today when the president of the Nigerian Medical Association, Dr. Kayode Obembe, confirmed the suspension in Abuja, the federal capital territory. He said doctors agreed to return to work after the federal government agreed to some of their demands. Dr. Bimbe also told journalists that the doctors will be resuming work tomorrow, Monday, the 25th.
This room may be small, but the issue that has brought these doctors here is not only a serious issue, but one that concerns every Nigerian, and that is the strike action embarked upon by the Nigerian Medical Association. The action, which began almost 2 months ago, with the NMA making a 24-point demand, including salary increase and other welfare packages, has now been suspended.
After due deliberation, delegates arrived at the following resolutions. 1. Delegates resolved to suspend the strike action in the interest of urgent national emergencies while negotiations continue. Consequently, all medical and dental doctors are hereby directed to resume duty at their working posts with effect from 08:00 hours of Monday, 25th August 2014. 2. The Nigerian Medical Association remains committed towards the health of Nigerians, and we to reiterate that she will not renege in her resolve and total support for the government in the effort to provide quality, affordable, and accessible health services for the Nigerian people.
This decision was also taken as a demonstration of support to the government in its efforts to contain the Ebola virus disease, which has so far claimed 5 lives.
The NMA mandates her state Ebola monitoring committees to continue to liaise with the state governments to immediately set up emergency response teams for the prevention and treatment of any outbreak of the Ebola virus in their various states. Delegates commended the efforts of the federal government and the Lagos state government in containing the spread of Ebola virus disease and for the establishment of isolation centers in the 36 states of the Federation and the Federal Capital Territory. Delegates demand immediate withdrawal of government circular and suspending the residency training program and sacking of 16,000 resident doctors who constitute about 70% of doctors' workforce in Nigeria. The NMA urges government on its part to reciprocate her goodwill in ensuring that resident doctors whose appointments were so terminated are reinstated immediately without any punitive measures.
However, this does not mean a stop to the demands of the NMA, as a decision, according to the leadership of the body, would not affect discussions with the federal government. They are optimistic that the suspension will make the federal government act fast by addressing their demands. Sheung Okimbaloye, Channels Television News.
Well, just a few hours after the announcement of the suspension by the president of the Nigerian Medical Association, the presidency applauded the doctors on their decision, but advised them to be more patriotic in their demands in the interest of the nation's healthcare delivery system. A senior special assistant to the president on public affairs, Dr. Dunyo Kupe, who spoke in Lagos this evening, gave assurance that the federal government is willing not only to continue negotiations with the doctors, but to meet up with their demands.
The demands of the doctors are many, but I make bold to say, and I'm being very sincere, that most of them are achievable and most have been acceded to by government. What doctors want is quick implementation, and I think this will be done. All right? From the government side, what we want is a lot more responsibility, from doctors. You don't want, like I said, doctors are not peasants, and so doctors should not behave like peasants. Doctors are expected to be noblemen, and the care and interest of their patients must be paramount. For instance, we're going through a period of insurgency. There are bombings everywhere and all that. That is not the time. If God forbid, a bomb goes off somewhere, 20 people are killed, 80 people are injured, and there are nobody to look after them. That's a major problem. So, that's why I said that the timing was inauspicious, and the duration almost inexplicable. But it has come, it has gone. We do not pray. On both sides, on the government side and on the doctor's side, it must, we must use this platform. Many of these things will be straightened out in such a way that the desires which I have expressed earlier on will come to fruition. That is, things can be done in such a way that we don't come back to a situation where, institutions of health delivery or care delivery is left, totally comatose because there's nobody to administer it.
The senior special advisor to special assistant to the president on public affairs, Dr. Dunyo Kupe, on the doctors' suspension of their strike action. As you heard in that short track-up, the Dr. Kupe talking about the ill timing of the doctors' strike action. To discuss this further, I'm being joined now by the former editor of the Daily Times of Nigeria, Mr. Ken Ubeche. Thank you for joining us on the News at 10.
Thank you, Amarachi. Nice to be here.
Well, you heard Dr. Okupe talking about how doctors, picked the wrong time, and he talked about the many people that they could have helped. I'm thinking that you're also, you agree with what Dr. Okupe said.
Well, in the case of the timing, the doctors couldn't have predicted there would be Ebola, because it's all about Ebola now. They went on strike on July 1st. Ebola was shipped into the country July 20th. So it's not about the timing, actually. It's about the rightness, the propriety of doctors going on strike and sustaining that strike action when there was a national emergency. I expected doctors, given the Hippocratic oath which they swore to have restrained themselves from continuing with that strike once a national emergency got into the country. The case of Ebola. I expect them to call off the strike or suspend it, go all out, take charge of these patients, take care of them. Then while you are taking care of them, public goodwill would have been on your side. The public would have sympathized with you the more. But now you are calling off the strike or suspending it because they didn't call it or they suspended it. At a time we have had harvest of deaths. At a time we have seen damage, real damage, collateral damage to the nation. Many people are quarantined now as we speak. There are severe cases of Ebola now, and you are calling off strike. Well, better late than never. But then, the damage has been done already.
Yeah, but it is still the time for the doctors to come back because, as you mentioned, yes, people are quarantined. I mean, the cases springing up all across the country. So the doctors are still needed. The services is still on time.
Definitely they are needed. No doubt about that. They are needed now, and even much more because you can see that the nature of the Ebola virus we're talking about is such that you don't know who the next victim will be, because it's not something that's written on anybody's face. So it's contained now. Maybe it's being kept in Lagos environment. We don't know whether they are spread to other states. So calling off the strike at this time is also germane, and I think it's laudable.
What do you make of the federal government's sacking resident doctors? This happened about 2-3 weeks ago. Do you see that as a backlash by the government of the doctors, or this is just isolated from, what's been going on?
No, I think it's also the attitude of Nigerian governments towards professionals in this country. And I've always sympathized with the medical profession because of the nature of their calling, of their vocation. These are the people that stand between life and death. And anywhere they are, in any part of the world, they are given special treatment. Because first and foremost, these are people that put their life at risk for the sake of others. For others to live, they put their own life at risk. And in the case of Nigeria, I don't think we have been fair to doctors. Nigerian governments have not been fair to doctors. And I think that's also why Nigerian doctors jet out of the country and they excel in Saudi Arabia, excel in Europe, excel in the United States, excel in UK. The same doctors that we treat shabbily here and shoddily go out there and they idolize. So there is need for government not to use the stick all the time. When there is a case of this nature, what are they asking for? They are not asking for an arm and a leg. They're asking for better condition of service, better working tools, better working environments. I don't think these are things that are beyond any government to do if actually government takes the life of the citizens as a priority. They shouldn't have allowed it to generate to this level.
Mr. Ken Obeche, thank you so much for speaking with us on the News at 10 on the suspension of the doctor's strike.
Thank you very much.